Case number 2 is a patient very common to my institution. We do a lot of trauma, and this was a young gentleman who was admitted after a motorcycle accident. He had a complicated left lower extremity fracture with disruption of blood vessels. Wound cultures about a week after his admission actually grew aspergillus, and the patient had been treated with voriconazole. So he had a very complicated hospital stay prior to the point where the T2 was actually utilized. He ended up having multiple surgeries, including an open fasciotomy on May the 4th. He had necrotic muscle and surrounding tissue, and he ended up undergoing an above-the-knee amputation on May the 6th. And according to the surgery note, the amputation site was above the area of necrosis and infection. So he remained on antibiotics for a day or two after the surgery, and then they were discontinued. However, about a week later, he was suffering from persistent fevers. His white blood cell count was increasing, and of course, he had been on broad-spectrum antibiotics for the majority of his admission, which was about a month at this time. This patient, again, had a T2 Candida ordered, and in this case, also positive for Candida albicans or Candida tropicalis, and again, you can see was collected at about 10:30 p.m. And called at about 3 a.m. in the morning. So he also had antifungal therapy started, and so we can kind of see the timeline here of where his white blood cell count started to increase, had several days, and then after antifungal therapy was started, he improved, and he was actually transferred about 3 days later to a rehabilitation center in order to recover from his amputation.